Item number 11, COVID update, Dr. Kelly and Susan Whelan, Executive Director of Public Health. Dr. Kelly.
All right, I am Dr. Leon Kelly. I am currently acting as the Deputy Medical Director for the El Paso County Public Health Department normally, and I continue to be the elected coroner of El Paso County. So today, we are here to talk about where we are with our COVID-19 response. Today is really a good day. We're here almost entirely to talk about the progress that we've made and the next phase that we're headed towards. But I want to begin by first thanking the five of you, as I have in our previous updates. Your leadership from the public health perspective and from the community perspective throughout this process has been tremendous. There is no doubt for everyone up here, everyone in public health, everyone in the audience, everyone in our community, the last 2 months have been probably the most challenging, oftentimes frustrating, uncertain times of most of our professional careers. But what we are here today to talk about is largely what we have accomplished, and then to look forward about what our rebuilding process looks like. But Commissioner Vanderwerf has been supportive throughout. Your leadership with our businesses and the recovery task force has been an incredible asset to us. Commissioner Brimmer, her personal connection to COVID, as well as her, drive-by pep talks and support that she's provided to us has been tremendous. Commissioner Gonzalez, your work with the Board of Health and your willingness to always give us an alternative viewpoint has been also an asset. Commissioner Williams, one of the things that we have appreciated is always supporting and allowing us to have the focus on our mental health and our mental well-being in our community, and always taking having an eye towards our schools and our young people, which is where we're going to work moving forward. And then obviously Commissioner Waller for not only being a confidant during this period, a mentor and a friend to help keep us all moving in the same direction. Ultimately, these decisions that we've made are our decisions, public health decisions. Legally, that's what we are here to do. But we have made none of those decisions without your counsel, your support, and I want to thank you all for that. We have accomplished much, but as we all know, we are in a very difficult position as we start looking for what we're going to do about our recovery and our economy and getting our community back to where we want to be. And your guys' role in that is going to grow even more as we move forward. And so thank you. Thank you all. One of our main goals here today is to communicate to you all, as well as our community, that El Paso County is in a position where we are ready to move forward. Polls just this week show that 80% of Americans have supported the stay-at-home approach to this in our social distancing. I don't remember in my lifetime the last time 80% of Americans agreed on anything. Almost 70% of those that support it are Republicans. And so we have done the hard work already, but now we're ready to begin the next phase. The reality is that we are here to convince those 80% that we are ready, that we are prepared to get moving forward. I spent a couple of hours this weekend trying to relax, and oddly, one of the things I do is I like to wash my cars. I wash the cars in the driveway. So I took my 10-year-old, teach how to wash a car. And what should have taken 45 minutes took 3 hours, because every neighbor that walked by stopped to ask me about our COVID response and where we were and what was happening. Unfortunately, I am now become the COVID guy, which is, I don't know how you go down from being coroner, but I have. And so every one of them stopped. My daughter eventually went in the house and said, "Mom, this is no fun. Every neighbor keeps talking to Dad about the coronavirus." And every one of them said is, we're excited to get where we're going, but we're scared. We're scared that we're not ready. We're scared that we don't have the testing. We're scared that people aren't going to do the right thing. All right, and so we're here to convince people that yes, El Paso County is ready to go, more so than every other county, but also that people have done the right thing, And I am pleasantly surprised to see our group here doing the right thing, because this is the kind of thing that we need to show our community and give that 80% confidence. Because we can open the businesses tomorrow, open them all. It does not matter if people are too scared to go to those restaurants, if they're too scared to go to those shops. So our job is to prove that we are ready. El Paso County is ready to go. Part of that, a big part of that is due to your leadership, and an even bigger part of that is due to our communities willing to do the hard thing now so we can get through this and get going forward. And so that's what we're going to talk about today. All right, so let's remember where we were a couple months ago. We were not in a good place. I described this as a 12-round title bout boxing, and we took some huge blows right out of the gate. We all know our bridge tournament. We all know our choir. We all know about the loss of our sheriff's deputy. And so we took some big shots, and our goal at that point was, hey, we have a plan. Let's stick with plan. Let's be disciplined, and this is what's going to happen. We're going to flatten this curve, and we're going to get through this as fast as possible, and that's what we've done. And I'm going to show data today that proves it, that shows that El Paso County has done better than essentially every other county from where we started to where we are right now. How did we do it? Okay, we did it in two main ways. The first was, remember, containment. That's where we use our EPIs and our testing to identify who's sick. We get to them. That's our SEAL Team 6 strategy. We're in, we're out. Nobody even knows we're there. We stop the spread of the virus. That works, and that's where we want to move forward. But when you have widespread community growth, you have to then backpedal to the next strategy, which is our mitigation, which is our social distancing, and all of those things. The reality is that measure, the social distancing, the stay-at-home order, is a blunt instrument. It is economic napalm. It's the most aggressive approach we have to deal with this. It has numerous negative side effects, which we all know and we all accept. So the goal from the beginning was to get through that phase as quickly as possible, to do it as efficiently and as effectively as possible, so that we can revert back to our more strategic approach, which is our containment. And that's where we are transitioning now. That's what this week and the future weeks are going to be about. The virus is still with us. It will continue to be with us. And so we have to be able to live with it and manage it in a way that doesn't have all the other negative fallouts that we have experienced in our community and our economy, not only in El Paso County and Colorado, but in our country and across the world. And so how are we going to do that? How are we going to transition from this mode of intervention to a more strategic, less harmful focus? We're going to do that in 4 ways. Okay, and the first briefing I gave here 2 months ago, it seems like 10 years ago, Commissioner Vanderwerf said something to me. And he said at the end, look, I know right now is difficult, and you guys are just dealing with the crisis as they come. But as things settle down, take a second to look forward and figure out what we need to do later to get out of this. Do you remember saying that?
I do, yeah.
Yeah, and at the time, to be honest, I thought, dude, we're so deep in the foxhole, like we don't have the time or the energy. Like the shells are dropping all around us. But that stuck with me, and it certainly I think stuck with us and was part of our plan. And very early on, we realized that this was going to be a struggle for resources. As our testing became clear that we didn't have it, our PPE became strained, our hospitals became taxed because of the PPE. We had to switch to some of these other modalities. And when we did that, it became clear, I think, to Susan and Dr. Johnson and myself and the rest of our public health leadership that we were not going to be able to depend on either the federal government or the Colorado state government to supply us those, to completely supply us with those things. We were going to have to build resources locally and in agreement locally and build some of these stuff up here so that we're not dependent on somebody else. And, you know, we didn't have to go full Hunger Games on this, but the reality is we did to a certain extent have to focus on how we were going to prop up things here. And Dr. Johnson's going to talk about that and the things that we did. So that's going to be one of them is local building capacity so that El Paso County is ready to go regardless of what everybody else is doing in the state or across the country. And so there are 4 things we had to get done to get to today. The first is a sustained decrease in our new COVID cases. We had to prove that we could control this thing. And as I presented a couple of weeks ago, we are in the place where we have done that and we have continued to do that from that point. And I'm going to talk about that data today. The second is increased testing capacity. You can't use that focused strike tactic of containment if you don't have enough tests to get people tested, to know who's positive, and to get to them. And so that's the first piece of this puzzle of putting it together. together, of being able to take these more strategic approaches that are less harmful to our community. Dr. Johnson's going to talk about that. Her and Lisa Powell have worked incredibly hard to shore up that testing capacity, and right now we are in an incredible place with that. For the last almost 2 weeks, we've been able to test anybody who's symptomatic, which is really where you need to be. That is not the case across the vast majority of Colorado. Colorado averages the state about 30 tests per day per 100,000. That's what they can do. The recommendation is 152 tests per day per 100,000. Right now, we meet that. Okay, we meet the gold standard of where we want to be, and that capacity is going to continue to grow. The third, contact tracing. Once you have those positives, you have to have staffing that can get out there, get to those people, get them isolated, get them quarantined, so we can focus just on the sick people instead of on everybody else. And so Susan, Director Whelan, has worked incredibly hard and will continue to work hard, and that's an area where we're going to need your assistance to help build up even more that staffing. So we're ready to handle this over the next 1 to 1.5 years. And then our hospital capacity. As we come out of this, we are going to have more cases. That's just the reality. And that is okay, all right? At some point, we have to let this virus travel through our community so that we get enough healthy young people with it that we can build up that herd immunity. We cannot huddle in our shelters for the next 1.5 years until a vaccine comes. That is not acceptable.
All right, nope. Here's what we're not going to do. I appreciate your enthusiasm, I do, but we're not at a sporting event here. We're a county commission hearing, so I'm going to ask, please, no comments from the audience as speakers are speaking.
So that's not an option for us. It's not an option for anybody. And so we have to make sure that we are able to handle those increased cases that are going to come inevitably. Our goal is to protect the most vulnerable while allowing the rest of us to continue and to progress in a controlled, appropriate manner so that we don't let this tiger back out of the cage, but we've got to move forward. And that's what we're here to talk about today. So here's our numbers, and this is cumulative, so obviously every case we get is going to go up. I saw an article this week, it was like, cumulative cases in Colorado continue to climb. Well, yeah, like every new case we have is going to go up. That's not the problem. The problem is how quickly does it go up. And here's our kind of daily case counts over since we had our first case back in early March. And you can see we peaked essentially kind of late March, early April, and it's been a relatively steady decline since then. We're going to have days that they're going to have a lot of cases pop up. Usually those are associated with the weekends because some of our testing sites are closed on the weekend, so people tend to come on Mondays and Tuesdays to get tested, and then the day when that comes back, the report date, those days tend to jump up. It's not necessarily a measure of exactly what's happening. I'll show a graph in a little bit that levels that out so we can see a little bit better. But we can see where we are. We're right at about 70 deaths. Our hospitalizations have slowly declined. We'll talk about that a little bit. As of yesterday, I didn't check it today, but I think we had 24, 25 people in the hospital currently in El Paso County, which is a really good place to be. And so we are very happy with this. Here's our doubling times, and this is where we talked in the beginning, which is what we were trying to control. Uncontrolled spread of the virus. One person has it, they give it to 3 or 4 or 5. Those 3 or 4 or 5 give it to 3, 4, or 5 more. That is unsustainable, even over short periods of time, because you're going to get so many people sick so quickly that just mathematically you're going to have too many people at the hospital. And that's what you see what we had very early on. Our doubling times were essentially straight up. These numbers show you the doubling times of days. So 15 days means it takes 15 days for 5 cases to become 10. We can see very early on in this, our doubling time was super short, probably less than a day, which is disastrous. As some of our strategies came in, we started educating folks. We got people apart. We got people washing their hands and doing those kinds of things. That flattened out. It continues to flatten out over time to the point now where it's almost completely flat. This is the flat curve that, as we all talked about for so long, we're looking for, and we certainly achieved it. This is that instead of seeing the day-to-day cases and hospitalizations, we're taking weeks, so we're combining all the days of the week into one data point, which evens it out a little bit. It makes it easier to see what's happening. Our blue is this is our onset date. So somebody gets positive, we interview them, and we say, okay, what day did you feel sick? Because the day they got reported has to do with a lot of different factors. What day did you start feeling crummy? And they say, what was this day? Okay, so this is the date, March 16th. We know March 16th is the day they really got sick. And so these are the onset dates. It gives us a better idea of really where we are. We can see it dramatically jump up that first couple of weeks of March, and then it starts to level off. This is when our social distancing went in place. And you can see almost immediately, as I talked about briefings previously, when you look at onset date, almost immediately when you put these measures in place, you see dramatic alterations in your trajectory. So we saw our social distancing. Yes, it worked. Immediately flattened it out. As it starts to decline, then we went to our stay-at-home orders. Stay-at-home orders was a more extreme version of our social distancing. And then you see it start to plummet as we continue through here. This is what stops our overwhelming trajectory, gets us leveled out, gets those cases declining, so on the back end we are able to deal with those cases as they pop up. It's not to prevent, it's not to stop the virus. It's not. It's to allow it, the spread, to be manageable by us, okay? So as we continue, we are going to have cases. Our admission dates, this is when folks come at the hospital. One of the things that people like to do is they like to focus on the number of cases. And that's okay, but there's a lot of problems with that. One is access to testing. You know the best way to prevent any cases from popping up? Don't test anybody. If you don't test anybody, guess what? You got no cases. You're doing great. No, you're not. You're horrible, right? And so we are now at a place finally over the last couple weeks where we can test everybody that needs it. So our numbers are legit. But really what we're trying to do, remember, is to protect our ability to treat those people who do get it. That's really what we're trying to do here. And so what we really want to look at is our hospital capacity and who's showing up there. And when you look at this orange one, this is our admission date. Once again, you know, you get sick, it takes a few days for symptoms to show up, it takes another few days for you to go get tested, and if you do end up in the hospital, that's going to take a little bit more time. So there's always going to be a lag between cases and hospitalizations. You can see we peaked once again with our hospitalizations at late March, and then we begin to decline after that stay-at-home order. This is the number that's going to drive how quickly we can move through this and how aggressive we can be, how conservative we need to be as we pull back. Our hospital's ability to deal with this is what we're going to use to be our prominent determinant of how we progress through this. And as of today, and as we have over the last several weeks, we are in excellent shape. Our hospitals are very happy with where they are and appreciative of the efforts that we made, but they are also ready to get going as they open elective surgeries and some other things this week. So let's take a look at some of the other counties. And once again, I want to remind you all that when we started, right out of the gate, we had top 10 highest case mortalities in the entire country. We were in a very, very bad place. And we were getting called out by national media, local media, everybody else. And I said right then, look, we're going to be fine. We have a plan. Let's work the plan. And these numbers will come down, and certainly they have. And so here's where we are. This is number of cases across the bottom. This is population across the top. Ideally, if your positive cases are equal by your population, this should be a straight line. All these dots should be lined up. Okay? If every county was doing the exact same level of quality of control, they should be a straight line. The more people you have, the more cases you have. If you're above this line, that means you have a high population, but you're on this end, you have very low case numbers. It means you're doing good. Right? You want to be up here in this corner. You want to have a lot of people, but you want to have very few cases, assuming you're testing them, right? And that's where El Paso County is. Anybody below this line is doing poorly, meaning they have more cases per their population than they should, given their size. And you can see the two places that are below that are Weld County and Eagle County. Eagle County got blasted right out of the gate because of people coming from out of town to ski. Then they infected all of their own local workers. That's what crushed Eagle County. And you see another graph that shows Eagle County's trajectory, and it was terrible early on. Weld County is in a bad place for very different reasons. And that's because early on they chose not to do some of the things that the rest of Colorado has done. And we'll see where they are now as well. The size of the dot is actually the number of fatalities. To raw fatalities. And you can see, even though we're as big as Denver, we have way more cases and way less fatalities. Even though we're bigger than Arapahoe, same thing. So we are doing really, really well with where we are, particularly when you consider where we started. Here's us compared to some other places. Now, this is raw numbers, so it doesn't account for your population. And El Paso County is green. You can see Denver continues to be on an upward trajectory. Arapahoe continues to be on an upward trajectory. Weld County continues to be on an upward trajectory. They have not yet got control. This is why locally they've decided not to transition to the next phase yet, because based on the data, they're not ready to. Look at El Paso County. We have flattened out weeks ago. We continue to stay flat. We are in really, really good shape. But this is where we really shine, and this is when you correct for population. This is Eagle County. Once again, they got slammed right out of the gate. Everybody else, Weld County continues to accelerate their case numbers on a linear curve. Most of these are starting to flatten out a little bit, but look at us at the very bottom. Despite being the one with the highest population, despite having significant population density in our city, we have made efforts from the very beginning that have dramatically changed the trajectory. El Paso County is situated in a position of strength at this point because of our leadership and because of the efforts of the people in our community, right? Because we didn't start out that way. And so this graph right here illustrates what community commitment looks like. And as we said early on, the reason we do this is so that we can get through it and we can get on to the next phase. El Paso County is ready to go. Some of these other places are not, to be honest with you. And so one of the other things we're trying to do is, as we progress through here, is learn from what's happened. One of the ways that we're doing that is by actually interviewing the people who have recovered, who obviously is an overwhelming majority of our citizens. And our questions are, how are you doing? How are you feeling? What was your experience like? Can we learn anything about the virus from that? But also it gives us an idea of the support that we have in our community and where the gaps are and what we need to do better. And so one of the things we do is, as we ask them, did you have access to resources during your time of isolation? We're asking people, if they're sick, symptomatic, to go home. We've got to make sure that we're able to take care of those people. A lot of that's going to end up on their families and friends. 90% of people said yes, thanks to families, friends, neighbors, their churches, all of these groups are able to support. As we talked about from the beginning, this is where our community can step in and help support these folks. 3% said somewhat. One of the things that was often mentioned was, look, I'm sick. It's tough for me to get groceries. 7% said no, and this usually dealt directly with either economic challenges or what they felt was access to good medical care. And unfortunately, these things have been with us, and it's times like this that exacerbate them and make more clear. Those discrepancies between groups and between people just become more magnified during these times. But this is a big one, and this isn't news to anybody in this room, but did you or someone in your household experience loss of job or wages? 35% said yes. Okay, that's going to be the next phase of where we're going, and what a lot of the rest of the talk is going to be about is public health's role in helping us get these things going, obviously in a safe, appropriate way, but this is a huge part of the next front of this COVID war. The virus is only part of it, and we all know that many of these other things are going to be felt for weeks, months, and probably years to come, and so public health needs to be focused on those things too. One of the issues, and everyone, although the five of you know, and many of the people in the crowd know, mine and Susan Whelan focus and priority of mental health in our community. And that's been an ongoing struggle for us. And the situation that we find ourselves in because of this virus is only going to make that even more challenging. And so what we've been doing is monitoring how we're doing. This is a syndromic data. So these are the people who show up to the hospital of various things, so alcohol overdose, opioid overdose, or heroin. As of yet, it's been relatively flat. We haven't seen a lot of change. That doesn't mean that that's going to be the way that it's going to stay. This is our suicidal ideation and suicide attempts. There's been a lot of talk this week about the mental health ramifications of what we've all been through. And as of yet, there does not seem to be much of an alteration. This is from the beginning of the outbreak. I can tell you right now that's not going to stay the case. That is going to be an area of concern and focus. At my office, there's been statements in the media that we've had this many more suicides. We haven't. We are actually down 2 suicides over the last 45 days than we were this same time last year. So we have not yet seen the effect. Make no comfort in that statement, because last year we went from 153 suicides the year before to 180. So the fact that we're on pace with last year is not a reason to celebrate. But we have not yet seen those effects. But when we look at completed suicides, the biggest risk factors are, marital discord, financial struggles, health problems, and grieving a lost loved one. Right? We got, marriages are strained, I'm sure, normally, but we've got 3 of those 4 going on right now. We've got a lot of loss and grief in our community. We certainly have financial struggles, and we've got people with healthcare challenges, and people are fearful. And so there's no doubt that that's going to be an area where we're going to need to focus. So we're going to need your guys' support as public health moves forward. One of the things that we're doing at Public Health to focus on this is the GRIT initiative. And this is a place where our community can step in. The people who are here to say, let's get Colorado open, let's get this going. This is where we need your help to make that happen. One is obviously doing what we're asking you to do to slow the spread. But second is to help the people in our community recover from this, build resiliency in them so they can take on the challenges that are coming. One of the things that GRIT's doing is we're hoping to train about 1,000 GRIT trainers. It's similar to mental health first aid, but more of a focus on some upstream things through UCCS to help people in the community who are struggling, who need that kind of stuff. So you can go to grit.uccs.edu, check it out, see if it's something you want to sign up for and be part of the solution instead of certainly part of the problem. And that is all I have from my perspective. Dr. Johnson is going to come talk about testing, health equity, and working with our hospitals. So thank you. And I'll be here for questions after and then for public comments. Thank you, guys.
Thank you, Dr. Kelly. Dr. Johnson, if you could, please state your name, and then you may begin.
Sir, thank you for the opportunity to be here. I'm Dr. Robin Johnson, Medical Director of El Paso County Public Health. And I would like to just tag on to what Dr. Kelly was saying about the mental health. This is something, and substance use disorder, it's something that public health has been aware of over the last few years, participating in our child fatality review team, putting together a Youth Suicide Prevention Coalition, working with our communities on crisis response teams, with our community response team in the city, and then Beacon with our sheriff's office into the county. And we've been working on a community navigation team and really looking at what are some of those upstream things that we could do and need to do to address some of the issues that were arising in our community even before COVID, and then recognizing now with the stresses of this pandemic that we will need to continue and in partnership with our community and community partners in addressing this, but also making those resources available and communicating to our community and the residents that there are resources for them, and really looking at that preventive piece of it. So as we look at the things that public health do and kind of where our sweet spot is. In healthcare, we've been tracking COVID by zip code. It's important for us because it tells us a lot about where we need to concentrate our efforts in prevention, but there's more to this. As public health, we have interest in our zip codes even outside of geographic spread of disease. There's a growing volume of evidence that shows that one's health is influenced not only by genetics and other biological characteristics, but also by a variety of social factors. Social factors that include access to stable housing, employment opportunities, healthy foods, healthcare services, quality education, safe spaces, and a number of other elements. These social determinants of health typically strongly correlate with the health status of a given community. So much so that we now associate your zip code as a potentially accurate predictor of your health. Armed with this information, El Paso County Public Health has been working with communities that struggle with equity. And with our increase in support, due to your support of us, for critical positions in the last year, we hired Maggie Johanna as our health equity planner. And she continues to support many different aspects of COVID and looking into these equity issues. We've been working as El Paso County Public Health since 2016 with the RISE Coalition to enhance Southeast Colorado Springs from within through citizen-led change. And our focus has been on tracking health as they address the social factors that lend to health. Maybe I'm hitting the wrong. Left click the mouse. Whoop, right click. There we go. All right. So when we look to health equity, due to social determinants, we know that these have existed before, and they're going to exist even after COVID-19. The pandemic simply amplifies these inequities in a vulnerable population, and this is due to the population already dealing with stressors, economic challenges, and access issues that are intensified during such times as this. These times highlight our need to stay engaged, looking at this with systematic, qualitative data to assist us. And trends in other counties are providing a snapshot of increased risks for certain neighborhoods or communities. Public health is looking at our own county trends, following calls, cases, case recovery, businesses, et cetera, to understand more fully where our continued focus and advocacy for health equity can have the greatest impact. These type of collaboratives in COVID-19 response have enabled us to meet criteria for moving into this safer at home phase from our stay at home phase orders. Continued support from leadership, partnering agency, and from the community itself is essential for the continued success of what we have already seen here in El Paso County. An important component of the success, as Dr. Kelly was speaking to, for our safer at home phase is going to be the ability to perform widespread testing. Public health and partners throughout El Paso County have put forth a tremendous amount of work to increase the availability for local testing. There's a gold standard out of Harvard that demonstrates the goal to be 152 tests per day per 100,000 people. So when we calculate that for the population of El Paso County, that comes out to be about 1,140 tests per day. And at the present capacity, we are approaching this or exceeding it with our partners at around 1,100 tests per day. This means we have, one, increased the lab ability to run those tests. They have the machines and the reagent. 2, we have the swabs and transfer media to actually collect those tests. And finally, we have staff and the personal protective equipment that staff needs to gather the swabs. And part of this is actually, we also are tracking with our partners how quickly they can turn these tests around. Early on, the labs were easily overwhelmed, and our turnaround times could extend out to 7 to 10 days. That is not helpful when we're trying to do case investigation and have a rapid response before they're spread. At this point, we have a 24 to 48-hour turnaround, and in some cases, if it's sent out in the evening, it can be even ready for us by morning. So that rapid turnaround is also an essential component of this testing that we will be tracking and have been tracking with our partners. As our partners have built capacity, they are looking at all of these factors to state the numbers of tests that they can project doing sustainably, right? So today, if they could do 2,000 tests, but tomorrow they would run out of PPE, they would not do those 2,000 tests. They want to be able to have it sustainable so that we have an accurate picture of moving forward into this next phase, day by day. So this capacity, however, is only as good as it is used. And so we are really, now that we have the availability and the capacity, we're encouraging all individuals with symptoms to get tested and trying to get that word out that we would really want to test early and test often. Next in our arsenal for prevention is the epidemiologic investigation. And we have increased our team for contact tracing to assure that we are able to identify any clusters or potential spread of COVID. And I thought I would just give you an idea of this expansion. So we typically have a base team of 7 individuals in our communicable disease and epidemiology, or TB, I'm sorry, CDTB, I'm so used to saying it with all acronyms, communicable disease and tuberculosis team. This has been expanded to 16, which includes our 2 epi leads, 9 case investigators, 5 long-term care facility outbreak nurses, and we have a surge for 7 other individuals for surge capacity. We have a backup of 10 more additional investigators through the coroner's team, and we presently have 35 recovery case investigators through the UCCS student nurses. There are 20 individuals from the Medical Reserve Corps who are training to be investigators, and 2 epidemiologists have been hired to also shore this up. Recommendations for targeted isolation and quarantine are the goal of this approach. If there are more generalized trends of increased cases, then the quarantine and isolation recommendations would be more generalized as well. So it's essential that we have this stepwise approach where we can have a rapid response and rapid recommendations for preventing the spread. It's the continued following of our guidelines in the Safer at Home orders will help us maintain all of the good work we have accomplished so far and learn where our sweet spots are in opening up and health safety, as well as developing and giving time for development of tools in our toolbox for potential future surges. So if you refer to our website, elpasocounty.org, you will find several tools for ongoing understanding of what we're doing, as well as why and how it's impacting our community. We really do want to take the opportunity to continue education. We've been thrilled with the partnerships of our community, not only in addressing COVID, but looking forward to wisely beginning to step back into community connection and a robust economy. And so with that, we have also created some weekly epi videos for the public, and we'd like to go ahead and introduce you to one of those right now. Thank you.
So there's multiple different ways that we're able to look at the disease within the community. And so one of those is obviously by talking to you as an individual, we're then able to categorize your illness and put you into kind of what we call an epi curve. And that is on our website as essentially a list of cases that we get every day. And so that is looking at the number of cases. And by looking at that number, we're able to identify trends within the community. Is the disease trending on upward? So are we seeing more disease spread within the community? Or are we starting to see that flattening of the curve and less cases being reported every day? So on the El Paso County Public Health Dashboard, you can find multiple different statistics and graphs regarding our outbreak here locally. The main graph is going to be our epi curve, and so what that is the number of cases that we have reported every single day in El Paso County. That is overlaid with a line of cumulative cases, and so that can show you how our outbreak is growing over time within the community. Both of these are by report date, so we're looking at the date that that lab or that illness actually gets reported to El Paso County Public Health. It's not the date date which an individual becomes ill. However, by being able to look at report date, we're able to look at the burden within our community and assess where we are in our outbreak. So some more information that's recorded in those graphs include the number of people who have had the illness in El Paso County but are considered recovered at this point in time. So that's how many people have become ill with coronavirus but have already passed out of their infectious period. So they have passed that 10-day period where we are concerned that they will be transmitting that infection to somebody else. We also have more statistics including age range, so who is more likely to become ill with coronavirus, as well as gender, so looking at are men and women equal in this illness, so is there something causing women to become more ill than men or vice versa? And then lastly, we also have numbers of hospitalizations and deaths. So who are we seeing that is becoming more severely ill with this infection? What types of people are becoming hospitalized? And unfortunately, who is dying from this illness? And having that information allows public health to target those populations to ensure that there are guidelines in place to protect them and prevent them from becoming ill.
All right, I think next in the presentation we have Dirk Draper from the Chamber of Commerce.
Good morning, Commissioners. I'm Dirk Draper, President and Chief Executive at the Chamber of Commerce and Economic Development Corp in Colorado Springs. And if you were to line up a picture and say which one of these doesn't fit, it's probably an economist who runs a business association. But following two doctors and an epidemiologist, I think we have a voice in this as well. If there's anybody who's looking for balance in the equation, I think I'd be in that bucket. I'm the son of 90-year-old parents who are in an assisted living center in Centennial. My wife has gone through the GRIT training as a facilitator in an equine therapy center here in town. My son's an epidemiologist with UC Health and at the Enchi Center. And I run a business organization that relies on the health and wellness of 1,400 members in Colorado Springs in El Paso County. So I'm really pleased to say over the last couple of weeks, I've learned more about epidemiology than I ever thought possible. And that's been thanks to the openness of the Public Health Department and working with us at the Chamber and EDC and listening to our concerns. The Chamber and EDC, let's make sure I can advance this. There you go. A couple of slides to share with you here. We're working hard to provide information, communication, and resources needed so that businesses can open safely, quickly, and successfully as possible. As Dr. Kelly and Dr. Johnson have shown, the data and the graphs, I think, are very encouraging for us in the effectiveness of the measures that we've seen implemented through public health here in El Paso County. We did start out poorly, and we've caught up and we've passed the pack, and I think their graphics evidently showed that. Our goal at the Chamber and EDC is to help ensure our economy stays open in a safe and orderly fashion, and it reopens in a safe and orderly fashion as well. We do encourage our business members and other businesses in the community to abide by the state and the county guidance for opening businesses and to implement those practices and all safety measures. What we're seeing says that the more we adhere to the guidance that they provided, the sooner we'll be able to reopen more businesses. The governor's tagline for his stay-at-home, now safer-at-home initiatives is "Be smart, save lives," and we couldn't agree more. We're doing our part as a business as well. At the Chamber and EDC, my 24 staff members will continue to telework as much as possible, even as the next phase relaxes early next week. If employees are in the office, they'll wear masks, they'll use gloves, they'll use hand sanitizer, and we'll take those steps that we need to set an example and to abide by the recommendations that are provided to us. I want to share with you some of what we're hearing from members and businesses. And we've heard this from several sources, from direct interviews as we work with our members, from surveys, and from anecdotes, from one-on-one conversations with businesses in the area. The graph you see in front of you is from a survey that was conducted by the Colorado Chamber of Commerce last week and the Denver Business Journal, and the results were reported there. What we know that business owners say that they want. Well, first off, here's the first graph that shows there is the conclusion. The quote is a conclusion from the Denver Business Journal in the article that it's companies by and large are okay with Governor Polis's plans to ease off of operating restrictions. 50% of the businesses that they surveyed last week said that they support a phased approach. 37% said it's moving too slowly. Another 12% said that it's moving too quickly. And those are from businesses across the state, companies of all size. The second question was, what businesses wanted from state government to help support them in a phased reopening process? And the top three things that were identified in that survey were improved COVID testing, access to PPE and safety equipment, and clear guidance on what their operating guidance should be for their industries. We've also heard locally they want additional, the testing is an aspect to know who is safe to come to work, PPE to keep their employees safe and their customers and their vendors safe as well. clarity to know how they should operate. And one that's not on the survey, but we have heard clearly, is liability protection. That's cited in the Denver Business Journal survey as well, liability protection. So they have assurance they won't be held liable if someone, a worker, a customer, a vendor, contracts the disease and blames them for being a point of contact, the vector where it occurred. Another question asked is, okay, we've done that one. We are working, so those are results from surveys. We did a survey of our members. It was back in late March. This is changing so quickly. We're in COVID time. It's like dog years, except in reverse. Feels like one day is 7 days of time as it passes. And so results that we had in late March really aren't relevant for the conditions that we face now as we're opening. So much more is known about the virus. So much more is known about effective treatment. And we're learning and adapting as we go. A couple of weeks ago, the Chamber and EDC reached out to public health and asked for consideration in response to concerns we were hearing from local businesses about restrictions that they face. These are local retailers primarily, and the restrictions that they face that their competition and national retailers did not face. And through a series of meetings that the Chamber and EDC and Downtown Partnership had with staff at the county, we were very pleased that they recognized that that local retailers could operate with curbside delivery and could do so in a safe manner. That gave Paso County businesses 2 weeks or more lead time ahead of relaxation and recognition by the state of that same conclusion that allowed curbside delivery for smaller retailers. Since then, we've begun to partner with the staff at Public Health in leading a local economic recovery council. The council is a collaboration that also includes the economic development directors at the county and the city. And our purpose is to ensure that local guidelines for reopening businesses balance the health of citizens with the health of businesses. We've met 3 times in the past 10 days or so to identify how we would work together, who else should be included in that tent, and just what our objectives are in coming together to share perspectives. And I'm very pleased on behalf of the business community, on behalf of the Chamber and EDC, the reception that we've received from public health that Ms. Whelan, Dr. Johnson, and the team at Public Health have given us. They're clear in their openness to hearing business concerns and to working together to serve and lead our region. This is, I don't know if we did a time graph, I think the work that we're doing is complementary to the council that Commissioner Van Der Werf has convened. If I was to label our measures differently, I think they're very complementary. I think Commissioner Van Der Werf, as we've spoken, agrees with that. His really is focused on immediate response, on resources for working capital, for finance, for immediate help put out the fire, and has been very helpful in the community conversations about doing so. As we've discussed this, he recognizes the complementarity of our work is, okay, the fire's out, now let's rebuild a house, and let's get this put back together. I serve on his council, and he has asked to serve on our council as we go forward. So we have good, clear, transparent conversations about this. We're also, the council that we've talked about putting together locally, or that we are putting together locally, is aligned with the State Council on Economic Stabilization and Growth. 5 members of our business community are involved, are serving on that State Council. Those include Aram Benjamin, from the CEO at Colorado Springs Utilities, Dave Lineweber with Anglers Covey, Doug Price with Visit COS, and Linda Weiss with the Colorado Springs Conservatory, and myself, and I serve as a liaison for outstate chambers of commerce to provide input and bring messages back from that state recovery effort. In closing, I'd like to say on behalf of the Chamber and EDC, thank you to the county and public health, and to our county and city leaders for having the foresight to see that a combined initiative, emergencies like this don't know political boundaries. And combining our OEM resources has allowed, I think, complete sharing of resources, information, and approaches inside the county, and it's served us well, as we've seen in the previous responses. That concludes my remarks and the prepared remarks this morning. I think the staff is ready to answer questions. Thank you again for the chance to visit with you today.
Okay, thank you, Mr. Draper. Dr. Kelly.
Yeah, a couple of closing comments. From the beginning of all this, as we've said many times, the perspective from public health is we are not here to tell people how to live their lives and be dictators in this process. We are here to get us all to the same place. We are here to be partners with our citizens, with our businesses, with our agencies, with our governments, to get where we need to be to do it together and get people back to work, back to the things they love that are meaningful to them, but to do it in the right way. And so from the beginning of this, we felt that we have been partners with our community. And we are in a place, as I've discussed earlier, of strength, where we're going to be able to be a little more aggressive in some of the things that we want to do. We'll talk next week about one of those things, which is high school graduations, so that we can get those kids that meaningful experience in their lives, because positive outweighs the risk as long as we're willing to be partners in that and do it the smart, medically sound way. Our promise from public health is we will work with you to get you where we need to be so you can get back to work and you can get back to doing things you want to do and doing it the right way. But our promise also is to the citizens that at no point are we going to do something that we think puts at risk the long-term success of this community. We've worked too hard to get where we are. We've built up some capital here. We have a plan. We've worked a plan. The plan has been successful. We are going to continue with that plan. But we are positioned in a really good place where we feel like we are ready to do some things that maybe other communities aren't ready to do. And so let's use that capital, but let's use it smartly in very focused ways that get the biggest bang for our buck and get our community back up and running as quick as possible. So thank you all for this, and we'll be here to take questions.
Thanks. First, from the commissioners, any questions from any of the presenters? Sure, we'll get to that in just a second. No questions. All right, so I do want to go to comments here. So Commissioner Vanderwerf, please kick us off.
All right, thank you, Mr. Chair. I do want to say thank you to all the speakers this morning. The presentation, the data, excellent. I do see analytics in that data, and you know how interested I am in that. So I'm thrilled to see those kinds of things in there. And I just want to say thank you to each and every person that's in public health and our OEM office, because you're under an enormous amount of pressure trying to balance a lot of really, really difficult things, and is not an easy task. I also want to just mention briefly, with my community economic response team, the team members that are involved in that have been fantastic. There's been great information flow. There's ideas about innovative responses to coronavirus, and also activities about how to get to a successful implementation of the governor's directives, of the state's directives. That information flow is very, very helpful. And those interesting questions about how do we get a whole bunch of other businesses and so forth open, like the tourism industry, which is going to get into full swing here in short order. It's a critical part of our economy, and there's people's livelihoods and food on the table depend on those kinds of things. And I also just did share with Dr. Johnson a conversation that I had with the Colorado Springs Dental Society, and so she's going to work with those folks about some of the challenges that they have, and I'm thrilled that we're going to take care of that this morning. And I'm also continuing to work on some other things. We've got some orders from the governor about closed campgrounds. I think there's opportunities there that we can make that a better place. And then the one thing that I haven't had a chance to share this with you, Dr. Kelly, but you all have directed or have asked, or, well, maybe that's not even the right term, but working on have been suggesting to the community while we've been in lockdown, get outside, get exercise, walk your neighborhood, walk in our parks, that kind of stuff. I think that's fantastic advice, and a lot of people took us up on that. And city and county parks got pretty full. So one of the processes that I worked on was working with the state to make it easier to access Cheyenne Mountain State Park, which is in fact through coronavirus been underutilized. And I see that as a pressure relief valve. So we actually had success with that. And I just want to thank the State Parks Department and the local director here, the Region 2 director, for taking the initiative to ease the access restrictions for Cheyenne Mountain State Park so that we can actually spread our exercise routines into a broader community, and that's been very, very helpful. And then the one last thing that I'd like to mention, I think it's great. I know we're working together on this. I know we're going to be putting more resources into this process, but the Workforce Center, a typical year would help about 15,000 people get into jobs. We obviously have a much bigger problem this year within that. What I've been saying to a lot of people is it's probably 30,000 people that the Workforce Center could hopefully get into jobs so we can get people back to work, because jobs are critically important. And that's 30,000 people in the second half of this year alone, so that's a fourfold increase in work. The great news about that is I know that there are resources that are being directed into the Workforce Center, so more caseworkers can be hired. So we are augmenting that staff, just like we augmented OEM and public health, and that's going to help the Workforce Center deliver more opportunities for people to get back. And there are going to be job displacements. There's going to be people that were in a particular industry, and that industry will take longer. Tourism and restaurants are going to take a little little bit longer to get back into a really healthy place. But there's other industries that are just working really hard, furiously hard, trying to find employees. One of the ones that I know of is information technology. We all know a huge demand today for IT companies to support businesses so they can improve their capacity to do remote meetings so that they can continue to do their work. So that's displacement. That's labor displacement going from one industry to another. That takes resources, and we're working towards getting additional resources into the Workforce Center to help address that displacement so we can get everybody we can back into a job. Jobs are so important. Without a job, a family doesn't have a resource to take care of their own problems, and that means they put less money into taking care of the health of their family, or maybe will be challenged about making the rent or the mortgage payment, or can't repair the car, or whatever the challenge is. So jobs are really important in this, and I do appreciate the Chamber and Public Health and our Workforce Center working on those issues and doing it in a team fashion. So thank you very much. Great briefing this morning. Thanks a lot.
Thank you. Commissioner Williams?
Thank you, Mr. Chair. So thank you very much, Director Whelan, Dr. Johnson, and Dr. Kelly, as well as Dirk Draper for this great presentation on our health department and our community response and our business response to this emergency that we have had. I'm very encouraged watching the numbers go down. So it's very encouraging to look and see where we're at compared to where we were at 5 weeks ago. As we move forward, it's my intention to just make sure that businesses and community members, we just want to make sure that they know, a basic set of requirements that we, would recommend they follow. And of course, all businesses have to consider their own insurance and liability risks. And after that, we are just looking forward to having them throw open their doors so we can go to work. And we appreciate very much all of the guidance we've had. The Chamber has done multiple outreach. We've had Senator Gardner, Senator Bennett. We've worked on, just a lot of people have worked really hard to make sure that everyone in the community stay in touch during this time, and I appreciate it very much. Thank you.
Thank you. Commissioner Bremer, do you have any comments for us? Commissioner Bremer, you're muted if you're trying to talk to us. Okay. Commissioner Gonzalez.
Thank you, Mr. Chair. So I just want to thank, all the presenters today. We've been working, hand in hand with Public Health and all the other entities and departments, all the great work. A lot is unseen, and so, we just want to make sure we acknowledge all the hard work behind the scenes that a lot of people are doing, lots and lots of people throughout the community, not just the county and the cities, but our residents as well have been working together. So many nonprofits as well. Being a member of the Board of Health, I've been following all those numbers and tracking those very, very closely. And so, seeing the positive numbers and the results of the successful implementation efforts of the county and the localities, it is difficult identifying that fine line between public health and the balancing of all those other factors. I see our DA here. He previously mentioned a spike in felony domestic abuse and violent sexual assaults. We mentioned today the likelihood of some suicide increases. Glad to see that has not yet happened, and we're going to do everything we can to make sure as best possible to help those people that need mental health or any other aspects. And so, businesses closing that may never open again, employees permanently losing jobs, many possibly losing homes, becoming homeless themselves. These are the things, all the factors that go together and things that we have to look at. I did hear that there was upwards of 1 million people calling the Colorado unemployment hotline over just a couple of days. 1 million people, and these are people that are potentially permanently going to be affected from this, and the virus itself is permanently affecting negatively families, friends that have lost loved ones. So I understand the fine line. I am very, very happy to see that the trends are continuing to show positive results, and that's why I did bring up the other day that I think this is the right time to start reopening. And talking to the governor, we have been doing that. The one-size-fits-all approach that he implemented is not the approach for everybody, and I think that we need to be able to take local control of this, and that's why I've been supporting that local control since the beginning, because we do have the right people, in public health in the community that can help bring this community together and forward. And so I'm happy to see that staff and public health and the community is ready to move into that next phase of reopening. And so I'm happy for all the feedback today, and I appreciate all the public that comes out to make sure that their voices are being heard as well. Thank you.
All right, I just got a text message from Commissioner Brimmer, and she says she does want to say something here. For whatever reason, her microphone's not working, so I'm going to do this. Oh, you got her? Okay.
Hello, this is Commissioner Brimmer. Can you hear me?
We gotcha. We're getting loads of feedback, though.
You know, really, I'll just keep it short then. Thank you to all of the health department staff, to Susan, to Dr. Kelly, to Johnson. You were providing us with data that guided us, and you've continued to stay on top of that and continue to provide that data, and it's painting a very different picture than it did in the beginning. And I appreciate the fact that we have that upon which we can make decisions. You know, the work you all have put in, it's really late back to normal. I'm looking forward to that, and I'm just very appreciative of all of the work. And you know, I think El Paso County has shown that making good and timely and personally responsible decisions, it has a cumulative positive effect on our getting out of this and recovering, I believe, much better than the rest of the state and the nation. So thank you for the work, and we have a lot of work ahead of us, and we're all 5 commissioners are committed to seeing us come out of this stronger. Thank you.
Thank you, Commissioner Brimmer. So in the discussion this morning, we had a lot of great data from our public health department, and we talked a lot about leadership, what leadership looks like during this whole crisis. Appreciate the kind word from Dr. Kelly. I think those are very nice. But I'll tell you, as a leader, you know, one of the tricks to figuring all of this out is how do you balance it all? How do you balance public safety versus making sure people are allowed to go about and live their lives in the way that they want to? One leader we haven't talked about at all that I think deserves a huge shout out here is our president. Our president, I think swift and decisive actions by the president have prevented this crisis from being nearly as significant within our country's boundaries as it would otherwise. And certainly our president is engaged in a lot of activities over the time, a lot of recommendations that have come out of the CDC. As a result of this, we're kind of starting to get back to normal, but there's still a long ways to go. We have a lot that we have to do moving forward. And, for example, the president put in place a travel ban to Europe. Sure, we'd all like to have the opportunity to go to Europe anytime we want, but it was necessary, right, and proper, and he said we need to do this. The CDC made very many suggestions about how we engage together, how many people we have come together in a room as we move through this crisis to prevent the spread of this disease as we move forward. And as we started to come out of this, the CDC has put out new recommendations. I think many of you have probably seen this document, Opening Up America Again. I'm seeing some head nods in the room, and so I assume that this is that you all have seen this, the President's guidelines for how we reopen moving forward. I appreciate this guidance from the President and the CDC. I think it's been tremendous for us, and it's done a lot to help keep our country and our communities safe. One of the recommendations out of these CDC guidelines, if you haven't had a chance to read them, I think you should do this. It says a phased approach to reopening the country. This is how the CDC sees us being able to move forward in the safest way possible. And it says this phased approach should be implementable on a statewide or county-by-county basis at the governor of the state's discretion. So the president's guidance here is saying, governors of the state, you have the discretion. Local governments, you don't have the discretion. Governors of states, you have the discretion to decide how your state needs to operate moving forward. Now, I've thought a lot about that. And I thought, boy, it would have been awesome if the president had said, county commissioners, it's your discretion on how you do things moving forward. In fact, I think that would have been great. I think that we can choose in our county a whole lot better than the governor can, right? We understand our citizens' needs better than the governor does. We understand our capabilities with our county better than the governor does. We understand our overall population and their willingness to participate in this recovery better than the governor does. But the president didn't say that in his direction. The president says it's at the governor's discretion. So you got to ask yourself, why is that? Why does the president say this is at the governor's discretion and not at the discretion of the local governments that are participating? Here's why. Here's why I believe that's so. I believe because the president is working with plenty of constitutional scholars that understand how this works. And the president understands the Constitution doesn't vest that constitutional right to deprive somebody's liberty in the county commission. It's not there. It's in public health departments, in that gubernatorial, in that state purview. And that's why the president said what he said. That's why the president vested this authority or why the president pointed to this authority that's vested in the state office. And so here's where we're left. We're left, how do we figure this out moving forward? The governor's office said, you know what, there's going to be you can apply for a waiver to ask me if I will ease some of these restrictions within your jurisdictional boundaries. I think that's a great thing. But three things have to happen. Number one, it's got to go to the public health department. The public health department has to sign off on that and say, yep, we can do this safely within our jurisdictional boundaries. We can ease these restrictions. Then it has to go to the hospitals. And the hospitals have to say, you know what, if we ease the restrictions and we have a surge of some sort, we're going to be able to handle that surge. And so they have to sign off on it. And then the third thing that has to happen here is that if those two criteria are satisfied, if you have the health department sign off on it, you have the hospital sign off on it, then it gets to come to the county commission for a vote. And if the county commission votes to move that forward, it goes to the governor's office and they decide whether or not we can ease restrictions. So here's where I'm left as a local elected leader. I've seen this Venn diagram out in social media, and maybe you all have seen it too. You have kind of the three circles that come together, and they come together in one little area. One circle is concern for the economy. That's something I have. I have concern for the destruction of our economy as a result of this COVID crisis. I do. I feel it. It's horrible, and I don't want to see our economy suffer any more than it already has. I get calls from guys like Dirk Draper all the time about what we need to be doing to move our economy forward. That's one of the circles, and it's a concern I have. Another one of the circles is the safety of our citizens, public safety moving forward. And so this is one I struggle with just a little bit, right? Because I'm not a public health professional. I have a harder time understanding, really what is the public safety, what's the public safety risk that we are looking at if we completely blow the doors off of something and try to open, I don't like to use that term, open the county back up, because I believe the county's been open. We've been doing the things that we're supposed to do. But what does it look like if we completely remove all of the strict restrictions? Does it cause a greater public health risk, or are we going to be just fine moving forward? Well, what do? I try to do what I do in all circumstances. I'm not a subject matter expert on everything, so I try to listen to the experts. In our case, that's our public health department. I try to listen to what they have to say in terms of what is the true seriousness of this for our public's safety. And I have to give a lot of deference to them because they're experts in this area. I'm not an expert in this area. They are experts in this area. What if what if our public health department's just sort of off the reservation or something? I don't think they are, not in any way. And I think that as their presentation showed us, doing absolutely the right thing in terms of preventing the spread of this disease moving forward. You can see that we're bottom of the graph on everything, and so I think our public health department's doing the absolute right thing. But let's say for some reason they're off the reservation and they're a public health department that's an outlier in some way. So where do you look to next? Well, I look to guidance from the federal government and from the CDC, the Centers for Disease Control, and I look to the President of the United States. And I'll tell you, we've had a lot of circumstances where both have said this is nothing more than a hoax. It's just a hoax that's happening, something to just deprive us of our liberties. I can tell you, I thank God every day that our president has not treated this like a hoax. I thank God every day that the Centers for Disease Control has not treated this like a hoax. So when I look at this, and as I'm considering this, and I'm on that Venn diagram, I have a concern for our economy, but I also have a concern for our public safety. And I have concern for our public safety because I don't think this is a hoax. I believe the president. I don't think it's a hoax. I think it's a real thing, and I think it's a real public safety issue. So I have a concern in that circle as well. And then that kind of third circle is, well, you know what? As we're moving forward through this, we have had some deprivation of liberty associated with it. And I have a tremendous amount of concern for that as well. I think in a free society, anytime we deprive somebody of liberty, it's not a good thing, or it needs to be done incredibly judiciously. You know, whether that's trying a criminal case and sending somebody to jail, that needs to be done incredibly judiciously. Whether it's asking people to stay at home, needs to be done incredibly judiciously. I mean, shoot, think about it. In the 1960s, there are probably many of you in this room that drafted and sent to Vietnam. That's a deprivation of your liberty. Liberty that's taken away from you, but done within constitutional norms and constitutional boundaries. So we have to consider all of these things together as we're moving forward through this crisis. We have to consider concerns for the economy versus those concerns for the deprivation of liberty versus those concerns that we all have for the public safety. And if there's one thing I can promise you from a leadership perspective, I'm going to go ahead and speak for this entire board. That's something every single one of us are concerned about. We're concerned about all of those things. And as we try to make decisions moving forward, we do it with all three of those things in mind. We do it with the economy in mind. We do it with the public safety in mind, and we do it also considering that deprivation of liberty that citizens are suffering. So I promise you this, we are working hard and diligently to get this county moving forward in the fastest, most expedient way possible while considering the public safety. All right.